Hello my YouTube friends. I welcome you guys to another video by our team. After a lot of discussions among our team members, we finally conclude that technology is the best solution that can be implemented to the problems in healthcare system in India. Before we study on the best probable solutions, here's a video showing precautions that should be taken on our side too.
बचाओ बचाओ
क्या हो गया इसको?
बचाओ बचाओ
चिल्ला क्यों रहा है?
बचाओ बचाओ
बेवकूफ।
बचाओ
कोई जानता है इसको? है कौन?
बचाओ कौन हूँ मैं एक मामूली इंसान जो खुद को और सबको कोरोना से बचाने के लिए इस मौसम में मास्क पहन के सबसे 6 फीट की दूरी रख के आधे घंटे से राशन के लिए खड़ा हूँ और उसके ठीक सामने ये बेवकूफ अपना मास्क उठा के खुलेआम सबको थूक के बीमारी देने की कोशिश कर रहा है। ये
सॉरी, वो आदत पड़।
मास्क पहन।
कोरोना थूकने से फैलता है, थूकी चंद।
अबे सही नाम है, सभी थूकने वालों को थूकी चंद कह के बुलाना चाहिए। ए थूकी चंद, थूकी चंद, थूकी चंद,
थूकी चंद मत बनिए।
अपनी बुरी आदतों को बदल के कोरोना की इस लड़ाई में देश की मदद कीजिए। जय हिंद।
Hello, myself Rohan. Now I am going to share my views on, is technology indeed the answer? If India is to realize its goal of universal health coverage, it is imperative that technology and healthcare talk to each other seamlessly. The good news is that the change is here. Technology is all pervasive and is helping address India's unique challenges in terms of accessibility, affordability, and quality. Though at a nation stage, the rate of adoption is rather fast, and given the size of healthcare sector, the resultant scale and impact can be immense. Technology will clearly be the backbone of this growth story. Adoption of electronic health records (EHRs) is key to improve care, reduce errors, and bring about cost efficiency by streamlining the clinical care process to improve outcomes. New age cloud-based solutions and mobile apps that seamlessly integrate provider and patient interactions will further boost the adoption of EHRs. Needless to say, the data gathered through EHRs over a period of time can help in further refining the analytics models to improve clinical outcomes. With increasing awareness of health and wellness issues, patients will soon start playing a major role in the overall process of care. Already, consumerism of healthcare is driving many of the new age apps dealing in prevention and continuous monitoring of health. Artificial intelligence enabled recommendation engines are helping consumers make choices that they never knew they could make. A high degree of personalization and care has been made possible through the use of technology. This is the need of the hour since chronic diseases are on the rise as a demand for personalized care depending on the illness and psychological makeup of the patient. Thanks. Now I would like Ahmed to share his views.
Thank you, Rohan. Now, I will be discussing ways in which technology will aid the healthcare system. Number one, reality in virtuality. The increasing use of smartphone and the World Wide Web has pushed the healthcare industry to use these modern day tools to bring doctors and patients closer. Various online portals now exist where patients can directly consult doctors via a phone call or even a message. However, ordering medicine online is filled with discounts and convenient deliveries. For example, organizations like Apollo use their telemedicine network to share everything from reports to graphs and have better healthcare facilities reach rural areas. The advantage here is it takes lower capital investment, setting up an entire hospital or buying new machinery, and efficiently uses available facilities like satellite network and internet. Number two, wiring in the electronic. With digital technology expanding and trickling, down to different industries. The healthcare industry has started using it for database. Each hospital can have its own centralized system of online records, accessible by any doctor on duty from anywhere in the hospital. Secondly, initiatives like e-health, e-pharmacy, and e-referrals are launched to bring in more users under the hood of electronic healthcare solution. With the advent of ordering medicine online, healthcare has now become even more accessible and easy. A centralized system for patients exists for long-term use, maintaining the entire medical history of a patient without repeated registration procedures, with a sole identification number and self-help groundwork. Number three, entering the clouds. The advantage of having online storage and going paperless lies in the usability of the data. This is achieved by the cloud feature of the healthcare industry. Both public and private enterprises are to tie up opting to tie up with cloud services and giving access to respected patients and doctors. This way, even if a doctor is traveling and their patient gets urgently admitted, he can monitor the case without being physically present. Many big brands like Microsoft, Google, and Amazon provide cloud.
No single measure completely eliminates your risk, but look what happens when they get added together. Know your risk, lower your risk.